Hi everyone, my name is Andrea, and for my healthcare leadership project, I was assigned Dr. Paul Farmer. So here we go. So a little bit about him is he was born October 26, 1959 in North Andover, Massachusetts. He grew up in Florida, where his mother and father always continuously read to him and always continuously had him strive for his academic excellence, where that's where he got really passionate about his academics and getting scholarships. He studied at Duke University on a scholarship and graduated summa cum laude with a Bachelor of Arts in Medical Anthropology in 1982. In 1990, he graduated from Harvard University with an MD and PhD. He completed his internal medicine residency at Brigham and Women's Hospital, and he was board certified in internal medicine and infectious diseases. He passed away October 21st, 2022 in Rwanda at the age of 62. He was a professor and university chair of the Department of Global Health and Social Medicine at Harvard University. He served as the chief of the Division of Global Health Equity at Brigham and Women's Hospital, and he was the founding chancellor at University of Global Health Equity in Rwanda. So important works prior to becoming an MD and having a PhD is in 1983 as an undergraduate at Duke University. He started volunteering in Haiti with farmers and he volunteered in the local hospitals in the Central Plateau region. There he listened to a lot of Haitian stories, and he became very passionate about learning the language and about learning Haitian history. And then he also volunteered in migrant labor camps. So near his campus, he began volunteering alongside Sister Juliana de Wolf, where he also listened to Haitian immigrant stories, and he was really influenced to learn Creole to be able to talk to these people and help them out. So some of his most notable highlights is first his creation of Partners in Health. So in 1987, he co-founded an international nonprofit organization that provides healthcare and advocacy to sick people living in poverty. So this is important because PIH helped to establish a comprehensive treatment program that trained local healthcare workers to deliver care and treatment for diseases like HIV, AIDS, and tuberculosis. They provided free access to medication and established programs for a DOT care model. They really advocated for addressing non-communicable diseases in low-income countries, and he had a very holistic approach to healthcare as he encouraged policymakers to rethink their strategies for managing health in resource limited environments. So the second notable highlight was in 1999, the WHO designated Paul Farmer to facilitate global multi-resistant tuberculosis treatment programs and deliveries for people in Haiti, Peru, and Russia. So this was important because this program had some of the highest cure rates in the world, and it was clear that treating the tuberculosis could be done cost effectively in poor countries with functional delivery systems. The third of his most notable highlights was in 2010, after an earthquake that killed hundreds of thousands of people in Haiti. Paul Farmer, through the Partners in Health, built a 300-bed hospital that allows those that previously didn't have access to healthcare have quality healthcare. And that hospital is also a teaching hospital, so it trains nurses and people in medical degrees that are from Haiti to have really quality education to be able to be the best nurses and doctors that they can be. The last one that I wanted to highlight was for the hospitals in Haiti. Haiti actually saw higher rates of vaccinations and lower rates of infant mortality and malnourishment because of the hospital and education system that Paul Farmer put in place. So the last one is the accompaniment model. With this model, he was able to pair patients with community health workers. This model recognized that social economic factors such as poverty and lack of education often prevent individuals from accessing the care that they do need. This turned into the guiding practice for clinical work among poor HIV and AIDS patients in Haiti, those suffering from the multi-drug resistant TB in Peru, and Ebola patients in West Africa. By providing support and education, trained community health workers empowered patients to navigate healthcare systems, adhere to treatment, and improve their overall health outcomes. So some other highlights is Paul Farmer was a part of a lot of research programs like HIV and AIDS, tuberculosis, maternal and child health, social determinants of health, mental health integration, Ebola response, healthy system strengthening, and global health policy. He also had a huge mentorship and influence impact on his students and people that he worked with. This is a quote from somebody that he worked with. He encouraged his students to view their work as part of a larger movement for social change, focusing on the duty to address the social factors that shape health outcomes and the willingness to challenge the status quo. He also helped Liberia and Sierra Leone with Ebola. He helped to work stop the Zika virus, and he also helped to make a COVID tracking program in Massachusetts. So how he relates to the class is he really helped work with vulnerable populations by his work with volunteering in Haiti, the Haitian hospital, the tuberculosis vaccinations and getting them to and from places, and then as well as his organization's partnership Partners in Health. Another relation to class is his numerous research efforts supported and contributed to innovations of the healthcare industry, including AIDS, maternal health, social determinants of health, and global health policy. So here are just some awards that he's gotten. He's gotten numerous awards, like the 2022 Berggruen Prize for Philosophy and Culture, the Margaret Mead Award, American Medical Association's Outstanding International Physician, the Hilton Humanitarian Prize, the WHO Director General Global Health Leader Award, and the Gold Medal for Distinguished Service to Humanity. And then I just wanted to leave us with a little quote at the end from him. With rare exceptions, all of your most important achievements on this planet will come from working with others, or, in a word, partnership. And Paul Farmer really did emphasize this in the work that he did. Everything he did was with partners and trying to make the world a better place. So thank you for listening to my presentation.